Hello and welcome to the Graduate Student Legal Aid's GRadulting Workshop Series. My name is Debbie McCutsky and I am the Coordinator of Services and Programs for Graduate Student Legal Aid. Our focus today is health insurance for UMD's graduate students. But before we start the presentation, I want to tell you a little bit about legal aid. I hope that I met some of you at orientation. But just let me take a minute to tell you who we are and what we do. So in addition to these workshops, we provide support to students in 4 more areas. First, legal consultations for local issues. Second, legal consultations for immigration issues. Third, advocacy for those facing university charges and those involved in Title IX cases. And fourth, notary services. That's me. I am a notary public and I'm happy to help you with that. So if you paid your student fee, then you paid for our services and there is no additional charge. So get your money's worth and reach out when you need help. So I encourage you to visit our website to learn more about our services and for instructions on how to request an appointment. And I'll send that out to you in the chat. Now, for the rules of engagement, a live auto transcript and captions are available. So you just click on the CC button at the bottom of your screen. This session is being recorded and I will send you the recording, link to the slides and some other resources tomorrow. We're not using the chat to communicate. We'd like you to use the Q&A feature. And the speaker will answer questions during the presentation as well as afterwards. And really, don't be shy about asking questions. We want to hear from you. We want to help you. So I am so pleased to welcome and introduce our speaker. We were hoping to have 2, but we are very lucky to have 1. And I will just introduce Robin Kotzker. She is a program director with the graduate school. She is pinch hitting today and just will share all the information that she knows about insurance for graduate students. Thank you so much, Robin, for being with us. We're lucky to have you back once again.
Thank you, Debbie. Hello, everybody. I know that insurance is a very stressful thing, and it's also for international students, it can be extremely confusing. So I'm going to try to help things along here. The colleague that was supposed to be here is the representative, is more of an insurance expert. I work at the graduate school, and my main role here at the graduate school is to help students with fellowships and awards, but I also know quite a bit about ship insurance, or I'm sorry, health insurance process here at UMD. So what I'm going to do is go through all of these slides, and if you have questions, if something pops in your mind, you can certainly unmute yourself and ask a question. You can type something into the Q&A if that's if you prefer to do it that way, and we'll field all the questions that we can. So I'm going to go through these slides, and if I apologize. These are not all of my slides. My colleague added quite a few of these into this slide presentation. So if I don't quite go into detail on a particular slide, it's because I may not have the expertise to do so. But in any case, I will do my best. So I'm going to share my screen. Let's get it here, screen number 2. Okay. So everyone now should see GRadulting health insurance slide. I'm assuming that it's working well. Let me know if it's not. And I will go ahead and start. If I can get, there we go. So this first part is healthcare in the US and a health insurance general overview. So one thing to know, and you might already know this, health insurance is expensive in the United States. Things to know, just a little frame of reference here, a simple fracture could cost $2,800 or more. Just simply going to the doctor or going to the ER at the hospital, getting the x-ray or whatever scans you might need, and all of that, all of the costs associated with something like that could be as expensive as that. Managing diabetes or other illnesses, it's expensive to do all of that here. Childbirth, if someone, that whole process will cost quite a bit of money as well. So having insurance helps with these costs quite a bit. Prescription medications, on average, the cost is 2.5 times more in the US than in other countries. So that also is an important piece. And they increase every year. So it's just important to know that having health insurance helps you with all of this. Some basic insurance terms. The word premium is the amount you pay for your health insurance. So my health insurance premium might be something like $200 per month. That's an example of how we would use the word premium. Deductible is the amount you pay for covered expenses before your insurance plan starts to pay. Some insurance plans come with a deductible, and some don't. It just really depends on your plan. So, for example, if my deductible is $250, I have to pay that out first before my insurance will pay. Co-payment or co-insurance is the amount you pay when using the plan for a particular kind of visit. So usually it's like a flat dollar amount, or it's a percentage. For example, if I was sick and I needed to go to urgent care or the University Health Center to see what's going on with me, I would have a copay. The copay would be something like maybe a $20 copay, and the rest is paid by insurance. So having a copay is a good thing because you only pay a small fraction of the total cost. Out-of-pocket maximum simply means that you are, if you have a serious health condition or something that costs a lot of money, there's a maximum that the insurance company would say would be how much you would pay out in the maximum. So, for example, if you have a $50,000 issue, your out-of-pocket maximum might be something like $2,500. So all insurance companies do have an out-of-pocket maximum. So out-of-pocket means out of your pocket. Some other terms. Preferred provider organizations. The acronym for this is PPO. That's when the insurance company allows you to choose any doctor you want. But the indications here, if you happen to, 3 things will happen when using a preferred provider. The provider will bill on your behalf. So they will contact the insurance company and get payment. Your out-of-pocket expenses are lower. There's no balance billing, which I think that just simply means they're not going to be billed more after the fact. Managed care organizations, the acronym for that is MCO, and care must be received from a specific network of doctors. So it depends on the plan that you have, whether or not you have a PPO, preferred provider, or an MCO, managed care provider or organization. Before I go further, are there any questions on that? That was a very brief overview of some terms about insurance. Do you have any questions that I can answer? Okay, that was a very, very quick overview. I don't know. I hope it helped understand a few terms for you.
Is the Medicare plan an MCO?
Medicare. I think I actually am not aware what Medicare is, if they're considered an MCO or PPO. Debbie, if you just record that question for me, I'm happy to sort of research that a little bit. But if Boyce were here, he probably would have been able to answer that question. That's where my expertise ends.
Please type the question in the Q&A so we have a record of it.
Thank you for the question. We'll try to get that answered for you. Oh, that might be Boyce, actually. That number looks familiar.
It is. I have to say, This is the most horrible feeling that I've had in months, and I apologize.
Well,
Zoom
we're
was
sorry
not
you
my
had that
friend
experience.
this morning, and
So sorry you had that experience.
hey,
Well,
yeah,
we're good. We got started. We went through the first 4 slides so far, and we actually have a question. If you're
okay.
ready for a question, then we can give you a question right
I
now.
am. Please bring it on.
Just one
Okay.
second. I just want to introduce who just joined us. This is Boyce Moran. And Boyce, thank you for being with us today. Boyce is with University Health Plans, and he is one of their vice presidents. Did I get that right?
So I'm actually with Academic Health Plans. It's just a sister company, but I've been doing student health insurance probably since before most of the people in this call were born, I'm sad to say. So I have to be here.
Wonderful. Well, catch your breath, Bruce, Boyce, and thank you so much for being here. So yeah, back to the question.
You're welcome.
Is
Okay.
Medicare an MCO?
Is Medicare and MCO? Some of Medicare or Medicaid?
Medicare is what the question was.
So Medicare applies for people who are over 65 or have end-stage renal. And many of those plans are managed care organizations. Medicaid, it really depends on the state and the program. There is no one size easy answer, unfortunately.
Okay, which I was telling them how
I always-
complicated. Yeah, thank you, Boyce. I mean, had been mentioning how insurance in the United States is confusing, and that's just one example. Okay.
Yes, yeah.
Excuse me, I'm going to point out that the same person at, I don't know if this is a correction, but is Medicaid an MCO?
So Medicaid is an option for basically people who have some disabilities or fall below a certain financial threshold. And Medicaid is really just a mechanism. It's a state subsidized plan. Some of them are PPOs, some of them are managed care organizations. The advice that I always give is to, when you're looking at a plan, look at not just the premiums, but how the plan works. Do you need to see a primary care physician like you do with a managed care organization, or can you go to any provider like with a PPO? I think nationally there's something like 2,000 Medicaid plans, and I would guess that half of them are PPOs and half of them are Medicaid. So just check with the specific plan.
Thank you, Boyce. So, moving forward, right now, Boyce, I don't know if you have access to the screen. Are you able to see the slide that we're on?
I can't see the screen, but I do have the deck open in front of me, Robin.
Okay, so we are currently on the slide at, called UMD, the insurance requirement slide.
Okay. Would you like me to take over, or did you want to?
I can continue, since this is sort of my this part is my wheelhouse. It's University of Maryland policy. So I'll start here, and I'll just call, when we get to a slide that I want you to do, I'll call you up. I love it. Insurance requirement at University of Maryland. You might have already known this. You've probably been getting emails from Academic Health Plans and the graduate school that say that it's a requirement for all students to have health insurance. The University of Maryland has partnered with Aetna Student Health to offer customized student health insurance plan. And the acronym for that is SHIP, SHIP. When we reference the student health insurance plan, we always say SHIP, but the SHIP this year is Aetna. So that is the carrier. Aetna is considered the carrier. To ensure compliance to our policy that all students have to have health insurance, students are automatically enrolled in the student health insurance plan. But graduate assistants, if you have a graduate assistantship, then you also have the option of enrolling in one of the state of Maryland health insurance plans. So that would mean that you would end up with, if you chose that option, that you would have other coverage So students who have other coverage can submit a waiver to waive out of the SHIP of this so that you don't get charged for two plans. You don't want to be charged for two plans. So bottom line is when you have to either enroll in the SHIP plan or waive out of the SHIP plan. So those are one very important thing that you have to remember to do. And to enroll or to waive, you would go to the AHP website, which is linked on this slide. One thing that at the bottom of the slide, it talks about waivers will be accepted for plans that are filed and approved in the United States. And note that plans sold exclusively to international plans are not filed in the United States, and they will not be accepted or approved as a waiver. So it's important to make sure that the insurance that you find outside of SHIP is ACA. What would you want to, Boyce? If you can just talk about this part, that would be great. The waiver acceptance.
So basically, most employer plans, the GA plan, the student plan, these are all plans that are filed and reviewed by regulators to ensure that all federal and state laws are met. There are a handful of plans that are targeted specifically to international students, and they try to file the plan in Bermuda or the Cayman Islands to get around those state and federal mandates, and those plans are not acceptable. So I just wanted to call that out. I haven't seen many of them this year, but it's always a surprise. Does that make sense?
Yes, thank you, Boyce. Okay, so I'm moving to the next slide, Boyce. So this next slide is Student Health Insurance Plan, the SHIP, that we've already mentioned once. And I've said this before, I'm just going to say it again because it's important. Students must either enroll in or waive out of SHIP during the open enrollment period. We're in the open enrollment period right now. The open enrollment period ends on September 26th. And we always advise students, if they have other insurance and they need to submit a waiver, submit the waiver early. So that way you can avoid the SHIP charge on your student account, or you can get the SHIP charge reversed. So it's important to get that waiver in. Waivers are good for 1 full year, and they must be submitted each year. New GAs can submit their GA offer letter because the timing of it all doesn't always work out. So if you are a GA and you're new this year, you can submit your offer letter as proof that you're going to be enrolling in the state of Maryland plan. To request a mid-year waiver, you contact the University Health Center. Sometimes insurance changes. There's a variety of reasons. Some students go on fellowship. There's a lot of reasons why it's important that the student might need to request the waiver process to happen in December. So if you fall into that category, you would need to contact the University Health Center. And if you need any assistance with enrolling in SHIP or waiving out of SHIP, you would also contact the University Health Center. We have another information page. The last bullet is the graduate school website. We have this health insurance information page that talks a lot about the different things that you might want to learn more about. Okay. And so if you do not enroll in SHIP and you don't waive, if you don't do anything, you're going to be automatically enrolled in SHIP. So that's something else to keep in mind. And so after September 26th, waivers are no longer accepted and you would be enrolled in SHIP and charged for SHIP. So the other option is the State of Maryland Employee Insurance Plan if you are a graduate assistant, a GA. So you are eligible to enroll in the State of Maryland plan if you're a GA, and it's not the same as SHIP. It is a completely different process and a different plan. Insurance carriers that are available in the state plan include Kaiser, United Healthcare, and Blue Cross Blue Shield. The cost ranges between $50 to $100 per paycheck, and it varies by plan, so you'd have to investigate that. The prescription drug plan is an additional cost when you go this route, whereas in SHIP, the prescription drug plan is included in the cost of SHIP. The premium cost will be deducted from the student's GA stipend. So if you're a GA and you choose to enroll in the state of Maryland plan, the premium that we spoke about earlier is going to be deducted out of your GA stipend every 2 weeks. And the coverage would remain in effect while you have your GA ship. Okay, so in terms of the process, if you are a GA, basically you get hired, and about 3 or 4 weeks after that, you would get an email from the state and it would have instructions on how to enroll. When you're a new person, when you're a new GA, you have 60 days to take that to opt in. And if you have questions, you would contact the University of Maryland HR office by opening a case, and there's a link there for askhr.umd.edu. Any human resource related question or benefit question is directed to them. So anything related to your job is directed to them. And if you're enrolling in the state of Maryland, if you enroll in the state of Maryland employee plan, you must submit a SHIP waiver. Okay, so now I am going to have Boyce take over. Boyce, this one is the SHIP overview. It's designed by UMD for UMD students. So I'm going to have you take over here.
Yep. Yeah. So first up, I would say that all these plans are good plans. They've been vetted. They're really affordable from a benefit perspective. They're all better than average. So you're in a good position there. But regarding this SHIP plan, so this is a customized plan specifically for University of Maryland at College Park. What's up? All right, I'll keep going.
Yeah, go.
So the plan itself does have. Is somebody asking a question, or should I just keep going? Can you hear me okay?
Yes, we can hear you. Keep going. Thank you.
All right, thank you. So the annual deductible on this, and it does run on an academic year versus calendar year, is $250 per year. That is waived at the University Health Center for office visits, including mental health, routine care, and prescriptions. There's no cost for anything that's being done at UHC, although there may be costs if they send lab work out or certain things, but most students have no cost at the health center. $25 co-payments when you access office visits, including therapy, and then most of the other services are at 8%. And then there's a $1,500 out-of-pocket maximum. So if you're in one of those situations that, say you're having a baby and it's $13,000, you're not paying 20% of that. It does cap out at $1,500 for the year. The plan that the SHIP uses, knowing that students move, is a very broad preferred provider organization. So we've chosen the most broad, least restrictive network when the students move. So any Aetna provider in the entire country is at the in-network level. There's medical evacuation, repatriation, which I'll talk about. The annual premium is $28.06, and that's per year. However, you're billed on a prorated basis for fall semester, which basically goes August through December, and then spring semester, which is January through July. I would encourage you for all these plans to look at, again, network, benefits, cost, limitations. If you're going to be traveling, a manager organization may not be a good option for you. Information on this SHIP is available at the AHP page. Robin, can you go to the next slide?
I have a quick question for you about the SHIP plan that you just said. So you had mentioned that any Aetna provider is accepted, and is that throughout the country or just here in Maryland?
It's throughout the entire country.
Okay. So if I have a doctor in Massachusetts that takes Aetna, if I have the SHIP plan, that would be covered?
Correct.
Oh, okay.
Correct.
Okay. Thank you.
Yeah, and to be clear, like there's a lot of benefits, and I tried putting the full benefit grid on there, and it was like 3-point font, so I kind of just put the highlights up. But I think 98% of the care that is being received under SHIP is in network, but there is a higher out of pocket for out of network care. And again, benefits that can all be found at the HP website.
Okay, thanks.
You're welcome. I'm not going to spend a lot of time on this, but in addition to just the benefits, there's a few things that we call value added services, and we've tailored these specifically for students versus taking kind of a shelf product. One is what we call academic emergency services. So if, God forbid somebody gets sick, they pass, there's this called medical evacuation and repatriation. So if, say you're skiing in Colorado, you fall, you break your leg, they'll air flight you to home, wherever home is. So it could be Maryland, it could be back in home country, home state. If God forbid you pass, they'll pay to have your remains shipped back. So that's all included. What most students use it for is if a family member, say a parent or a spouse or sibling gets sick, they pass, rather than calling Expedia and booking the last minute flight, they'll actually pay to have you be flown home to be with them, or if you're hospitalized, they'll pay. So there's a bunch of stuff there. There's a service called Academic Live Care, which is free. It provides unlimited online virtual visits for therapy, psychiatry, and urgent care. And then there's a vision benefit, which provides free frames and single vision lenses at no cost. And that includes sunglasses. I personally got a pair of like Ray-Bans for free through this. So certainly some good value added stuff there. Any questions on that before I get into the actual process? Right.
Okay, I switched to the
So
next
if
slide.
you go to, yeah, I can see that. Thank you so much.
Okay.
If you go to umd.myhpcare, there's a bunch of information. You can do some research on the plan. You can see if your providers are in network. But most of the people that are coming here are doing one of two things. They're either waiving off the plan or they're enrolling. If you do nothing, you'll be automatically enrolled and coverage will start on August 1st. Realistically, that process of taking the non-responders, and I think right now there's about 6,000 students on campus that have not responded, we will not send that over to Aetna until probably the middle of October once we get more waivers in and everything else, but coverage is backdated to August 1st. If you know that you need SHIP, that you're taking this, it's the right choice for you, I would encourage you to begin enrollment. It takes, 45 seconds to 1 minute. But what will happen is you'll be added to Aetna's system within 2 or 3 days. And again, coverage begins on August 1st. So don't use the non-action as a, as a call to action. Like if you do nothing, you'll be enrolled, but it's going to take some time. If you know that you need it, take the 45 seconds and click now. Any questions on that?
I have a quick question, and you might get to this, but I just waived SHIP before this meeting because I was planning on doing like the staff insurance. And if it turns out that the SHIP is better for me because I can be seen throughout the country, is there a way to unwaive it?
Yes, so you simply go into your account and then you can change your selection easy enough, and that actually happens quite a bit.
Okay, cool.
You'll need to make that determination, but by September 26th, so you still have a couple weeks.
Okay, cool. Got it. Thank you.
Okay. And then I always like to put some tips. These are the things that if I was just talking to my own kids, these are what I want them to know, not specific to CHIP or the GA plan, but throughout your life, you're going to be asked to go through open enrollment. And when you do look at all options, don't just look at the premium and say, oh, it's cheaper, I'll take the cheapest plan. Look at the out-of-pocket. Look at what the network is like. Are there restrictions? Are there exclusions? It's complicated, but I see students all the time that choose the lowest option, and then they have to choose between paying unpaid medical bills and paying tuition. And that's a really difficult conversation. In general, know how your networks work, choose a preferred provider whenever possible. Obviously, if it's an emergency, like if you get hit by a car, I don't want people online trying to find a net provider. Call 911, they'll take you to the emergency room. And if it's out of network, those emergencies are still paid at the in-network level. But for all the other stuff, just take the time and don't just assume because you could be hit with a huge bill. Emergency rooms, if anyone's ever been to the emergency room for something that's not an emergency, you know you're going to be waiting for 7 hours. There'll be people in the hallway and caught. So just go to the emergency room if you think that you're going to die or if it's really, really bad. With medications, if it's available, choose a generic medication. It's going to save you a lot of money down the line. I always suggest keeping your ID card of whatever plan you have on your phone. There's nothing worse than walking into the emergency room and they go, what is your ID? And you're trying to figure out how to access it. Keep it on your phone. It's super easy. And then if you heard us talk about deadlines once, you've heard us talk about it probably 15 times, make your decision for the deadline. Every year a student says, I'm going to do it tomorrow. Tomorrow becomes next week becomes October 1st, and it's a really expensive procrastination. So just make sure that you either enroll or waive by the deadline. Any questions on that? Great. And then if you could go to the next slide, Robin. And then just wrapping up, I always like to just have, who to go to for what. So the on-campus health center is fantastic, really dedicated to students, really built their entire practice. So begin at UHC. In the building, there is an insurance office that is to help both with SHIP and to some extent with the GA plans. Academic Health Plans, my company. If you need help with the waivers, if you need information on how to find a provider, and all that stuff's there. And then there's 2 links for the for HR for anybody who's looking at the GA plans. And that is the extent of our insurance brain dump, for lack of a better word.
Can you explain?
Robin, is anything that I missed?
I'm so sorry.
Well, we do have
Right.
several questions in the Q&A. Robin, do you want to present those or shall I? I can't hear you, Robin. Maybe I'll do that while Robin figures that
Maybe
out.
All
you
right,
could
I'm
read
here
them, and then
now.
depending on if
What
Go
were you
ahead,
saying,
Grace.
so
Boyce?
if you could read them, and then depending on the question, Robin
Yeah.
and or I would answer, but I can't
Sounds-
see them, unfortunately.
Of
That would be
course.
fine.
Sounds
Yeah,
great.
so you read them and we'll answer as we need to.
Sounds great. Thank you. Okay, so first up, if you are not a resident of Maryland, are you still eligible for Maryland state health insurance?
Oops, hold on.
You have to be a resident. So you do have to be a resident of Maryland, although I believe the state of Maryland does make it easy to redefine where you reside. What's that, Rob?
I missed the question. Are you talking about the eligibility for the GA, the State of Maryland Health Insurance Plan?
All right, so the person who posted that
I
question, will you clarify? Please, maybe unmute yourself.
Sure. I live in DC. I have DC Medicaid. So I'm wondering, do I still need to waive health? Do I still need to get University of Maryland's health insurance? And if so, am I eligible for Maryland State or no?
So if you only,
I would say, I'm sorry, Robin, you go ahead, please.
Okay, so in order to be eligible for the state of Maryland employee plan, you have to have a graduate assistantship. You have to be in Workday with a position. That's the only thing that makes you eligible for the state of Maryland health insurance plan.
Yeah.
And yes, you need to waive out of SHIP. And you are eligible for SHIP, though you can enroll in SHIP if you prefer that over
Yeah.
Medicaid in DC.
Okay, so even though I'm not
Yeah.
a resident,
So
but I
I
do
think-
have graduate assistantship, then that makes me eligible for everything.
That's correct. But yes. Mhm.
Okay.
All right, how much is the SHIP payment? I know you provided an annual number. What was that again?
It is
Give me
2806.
one moment.
I have it in my head, actually. So it's
Okay, thank you.
it's 1630 for the year. No, I'm sorry. It is 2806 for the year. It is, but we bill it by semester. So in the fall, it's 1176, and in the spring, it's 1630.
All right, sounds good, thank you. So, if someone submitted a waiver, when should they expect the SHIP charge to be reversed?
It takes 7 to 10 days. So when you submit a waiver, you'll get the approval or the denial notice a few days after that. And so if you're approved, it then takes another 7 to 10 days for it to actually get reversed on your student account.
Okay,
And if you don't see it get reversed, contact the University Health Center and they will make sure to get it going.
got it.
Robin, can I just clarify one thing? I get this question quite a bit. The charge itself doesn't get quote unquote removed. There's a credit further down that corresponds with the 1176. Is that correct?
Right. So you on the student account, you're actually going to see the charge, and then you'll see it won't be removed from your account. You'll just see a credit in that same amount. So you'll see the charge, and then you'll see a credit, and that's for the approved waivers. So you'll see both on your student account.
Got it. Thank you. So here's a student, they've been asking HR about sending a link to enroll in the GA staff plan, but they haven't received it yet. Who should they contact to get that?
So at this point, are you talking about the email that's supposed to come 3 to 4 weeks after you have your GA ship?
Yeah, I am.
Okay. So do you know when your GA ship started?
Yeah, it was on August 17th.
Okay. So so it's probably going to be another week or so before you see it.
Okay.
But what you can do is open a case with askhr.umd.edu.
I already did.
Oh, okay. You can
Yeah.
certainly do it that way. Then another option is to actually contact the state of Maryland benefits office, and that's just not the university campus. That is the state of Maryland, and you can sort of ask. So what they do is, like, when they have new GAs, there's files that are sent over to the state of Maryland, but it's not every day. They send these files like every 2 weeks. So
Okay.
that's why there's that delay.
Okay, so I submitted a case with HR or whatever, and they said there's nothing we can do, you have to wait. So I guess and then I'm like trying to get prescriptions from an out-of-state doctor, and pharmacies here being difficult because they're like, your doctor's from Massachusetts and you can't fill it here. So it's kind of this whole mess. So I'm just trying to figure out what is best. But okay. So maybe
Yeah, that's frustrating that you have to wait, but it's if you want to contact the state of Maryland benefits office, you can. If you Jenna Billion.
Yeah,
I mean, I'm happy to.
I took down your name. I'll send you an email.
Okay.
Okay.
Yeah, send me down, and I'll give you that email address. They respond pretty quickly, and they can tell you whether or not they see you or don't see you. I mean, that's one step to find
Yeah.
out.
Totally. Okay, cool. Thank you. It
Mhm.
seems like the person who's in charge of our department is on maternity leave, so there's somebody else, and she's like a little bit like behind, so maybe they won't
Sure.
see. Okay, cool. Thanks.
Uh-huh.
All right, thank you. Next question. Now you did address this, but are the premiums for the SHIP, are they taken out of the student stipend?
The premiums for SHIP are not taken out of the student's GA stipend. The
Okay.
premiums for SHIP are billed to your student account. And so they, the billing office, you'll get the bill and you'll have to pay the bill that way. So it's not out of your GA stipend, but the state of Maryland insurance is out of your GA stipend.
Got it. Thanks for clarifying that. So goes back to the value added things. For SHIP, are eye exams covered by medical insurance or AVC?
That's a voice question.
So they are not covered by AVC. They are covered for medical reasons and preventive underneath SHIP.
Perfect. What about dental? Is that covered?
Dental is not included in SHIP. As a general guideline, most medical plans don't cover dental. But on the SHIP plan, there's a voluntary dental plan that you can buy through Delta. And I believe there's a dental option under the GA options as well. But those would be
There is.
outside of medical.
That's true. That is the same with the state of Maryland plan. It's an additional insurance. It's not part of the regular medical insurance.
Okay, very good. So can a student have more than one insurance in different states?
They can have more than one insurance. In fact, I personally do for a couple different reasons. What would happen is there's a sequence of who pays first versus secondary, and it's really complicated depending on if it's a policyholder versus dependent and who's been in place longer. But yes, it is possible.
All right, thank you. All right, so it looks like someone is trying to decide between the SHIP plan and the GA plan. And this is a really loaded question, but can you explain the difference between the SHIP plan and the GA plan? Or why would someone choose SHIP over the GA plan? And if that's too complicated, we understand.
Yeah. It is really individualized answer to this question. There's some things that are different about the plans. I can provide a sense. So one thing about SHIP is that there's no copays at the University Health Center. One thing about SHIP is that it covers prescription drug, whereas the state of Maryland plan, when you opt that way, you have to get an additional prescription drug plan. But other than that, I mean, the other thing about SHIP is those other benefits that Boyce briefly mentioned. There's a couple other benefits related to strange emergency things that could happen. But other than that, it's a personal decision, and you just have to go and look at the different plans and see what's best for you. Some people are very, want to make sure they have maternity coverage, the right kind of coverage for that. Some people want to make sure that there's vision. Some people want to make sure that a certain drug is covered, so there's all kinds of different things that people look at. And in addition, what Boyce was saying, the copays, the out-of-pocket maximums, all of those things also are something to look at.
All right. Thank you, Robin.
Mm-hmm.
All right. Dental. Do either of you know how much it is? The dental through, I guess it's Delta Dental. Do you know how much it is?
It is Delta through SHIP. It's Delta. Through the University of Maryland, it's I think there's two different ones to choose from. Delta is one of them, and I think the other one is Concordia.
Yes, United Concordia.
United Concordia. Yeah. So the cost for United Concordia, I think it's like $80 a month. I mean, is it $80 a month? Oh, I have family coverage. That's why. So I don't know the cost offhand for an individual.
Okay, but that information would be available online.
It should be. I know it is on the UHR site.
If you just SHIP,
go ahead, Boyce. Are you trying to give us a number?
Yeah. So for SHIP, it's $455.04 per year.
Okay.
And I believe all these plans, they cover pre-existing conditions and waiting periods. They're all good plans. The SHIP version is a PPO. I think the Delta and United Concordia on the GA one's a PPO and is a dental maintenance organization. So subtle nuances, same kind of rule applies about just figuring out what makes the most sense to you.
Yep, thank you, Boyce. So is it required that a student does SHIP or the Maryland plan if they have health insurance in another state?
That's when you submit a waiver. If you have insurance somewhere else that's acceptable, you can submit a waiver, and if it gets approved, then you're all set.
Got it. And you said
The only thing that I would add to that, could I add one point?
Of course.
To that? So while waivers will be accepted, we do see several cases a year at Maryland where somebody waives off with an HMO from California or Massachusetts or some other place that covers only emergencies in Maryland. I would strongly discourage that. We've had cases where someone tore an ACL, the emergency room was covered, they had to fly home with a torn ACL to have the surgery and all the PT done. So just make sure that it's good on campus, but it's not a requirement.
Good point. Thanks, Boyce. Okay, and this is our last question because we are running out of time. Is the SHIP plan all 12 months of the year? And I think I heard you say it started August 1st, right?
Yes,
It
it
goes
is an
August
annual
1st to July 31st. Yes.
Yep. Full year.
Got it. All right. We covered a lot. And you know, Boyce and Robin, I know you have to say, because it's the reality, you know, all of these decisions really depend on each individual's situation, and we can't tell you what choice to make. But we can provide you with the nuts and bolts so that you can get the information you need. And Boyce provided that slide with information about how to get answers to your questions, because we know you'll have questions after you leave us here. So I would say reach out and we will all do our best to help. So, and there is a person asking one last question. Are there advisors on campus who can help with more personal questions? I'm assuming that means related to health concerns that they're having.
Is it related to health concerns, or is it related to choosing the insurance plan for you?
So you can just choosing the insurance plan.
Yeah, I think that basically we don't have somebody to help you make. I mean, we can only, the short answer is no. There's really no advisor to assist you in making that choice. It's a choice that you need to investigate and search around to look at the plans and determine what's best for you.
Right. Okay. And
I would also just add, if I may, I don't think it's like, I wouldn't overcomplicate things. Like I would do a spreadsheet of like, what's the cost? Is it going to cost me? What's it going to cost me when I access care? You know, the big gotcha moments really come around high deductibles, which none of these plans have, and around narrow networks, which can be much more restrictive. So, you know, typically PPOs are going to be great. HMOs will be more restrictive unless you know that you're staying in the DC area, for example. But
yeah, I mean, all of these plans that, you know, as far as SHIP versus the state of Maryland plans, they are all Affordable Care Act, you know, compliant with the Affordable Care Act. They're all good plans. They all, you know, they all have a network of doctors, you know, so the basics are covered, but some people have individual needs, and that's where the research needs to come in. And as Boyce mentioned, you know, they might have slightly different copay structure. They might have a different deductible structure. So that's what you can look at to determine what might work best for you.
Really quick, one more question. I know we're out of time, but so I know that there's nobody that I can go to like discuss what is better for me, but if I have like specific health issues, is there somebody to help me decide? I know that you would ask like when Jessica asked choose, I don't know. You were like, is it because you're trying to choose the insurance or because of like medical issues?
Right. Well, so some people have specific drugs that they're on because of a condition that they have. And so many of these insurance companies, they might provide a list of drugs that are covered and not covered.
So I'll
So,
just search.
yeah. So it's a matter of digging.
Got it. Thanks.
Mhm.
All right, I'm gonna let this last question slide in about getting immunizations. Are they covered under SHIP?
I don't
Yes,
know that answer. Okay.
What was that, boys?
they are.
They are. Okay, yay.
Immunizations are covered. There's a few exceptions. So, like, for example, I don't believe that rabies vaccines are covered. So if you're a vet student, that may or may not be an issue. But, you know, most of the immunizations that are going to be done for incoming students, MMRs, and even the titers to see if you have immune, like all that's included at 100%.
Got it. Thank you. All right. It's 1:32. Thank you for staying a bit later. Robin and Boyce, you two are so capable, and we appreciate you making the time to answer everyone's questions. And thank you everyone who joined us today. We appreciate hearing from you. We want to help you through this. It's always good for us to spend time together. So watch your email for an update tomorrow. It'll include a link to the recording, an evaluation for this workshop, and the slides. So have a good week and good luck with this semester, and let us know how we can help you. Thanks. Bye.
Thank you. And Debbie, I will send you the should I send you a PDF of the slides? Would that be the best?
Whatever's easy. If you don't do a PDF, I will.
I mean, if you go to that link now, it'll be, this is what we presented.
Oh,
It's,
okay.